On a yearly basis, for folks who are on Medicare and taking medications, there's sort of a well-planned out journey that happens as they purchase their prescription medications. And each dollar that is spent starts a countdown to the point in time where they will have no more costs for the remainder of the year when they finally reach medication nirvana for the year at that final catastrophic stage. But in 2025, the path has changed substantially. So today we're going to talk about the 5 ways that the yearly stages of Medicare Part D will change for the better in 2025. Hi, I'm Michael, and this is Michael's Medicare. Any of you or somebody you know is trying to figure out what is the best Medicare options for them this AEP, or really all year round, give us a call at the information down below and we can help you make those tough Medicare choices. Now, there's been a lot of talk about how the new changes from the Inflation Reduction Act of 2022 are going to be coming into effect in 2025. Most of the discussion has been around what it's going to do, like get rid of the donut hole. But today we're going to talk about the nitty-gritty of how it's going to actually improve the lives of Medicare beneficiaries. So here are 5 ways that the yearly Medicare Part D stages are going to change in 2025. So first up, like most journeys, somebody's Medicare Part D journey through the years starts at the beginning. And the first step in the process as of January 1st is the deductible. And this is because the Medicare Part D plans all start with a deductible stage. And the deductible stage is the part of the Medicare Part D journey where the beneficiary is responsible for 100% of the cost of their medications and pay out of their own pockets to fulfill their prescriptions until they reach the limit or the next stage. Now, not all plans have deductibles, which means you can move right instantaneously to the next stage if that plan does not have it. But if it does, then you gotta pay 100% out of your pocket. And many of those plans that do not have deductibles are going to be paired with things like a Medicare Advantage, also called MAPDs. But there are also a few standalone Part D plans that don't have deductibles as well. So those are all good options. Take a look. They're going to change wherever you are. But most of the standalone Part D plans will have some level of that deductible. The deductible will range pretty wildly depending on the plan and the formulary and the copays. But one thing that is true is going to be the maximum limit on the deductible stage in 2025 is going to change. And by that I mean it's going to get a little bit higher at $590, up from $545 in 2024. So once somebody hits that deductible dollar amount, that is when they move into the next stage of their yearly Medicare Part D journey. Next up, once a beneficiary gets out of the deductible stage, they will have a yearly medication spend potentially at the maximum of $590. And once they get to this point, they reach what is called the initial coverage stage. In this stage, it is when the insurance starts to kick in and folks will pay a set copay or a set percentage of their cost for their medications, and the insurance will be there to help pay the other portion. This split is generally going to come out to 25% responsibility for the beneficiary, 65% paid by the insurance plan, and 10% covered by the drug manufacturers or can be discounted. And this is all pretty similar to the previous year, at least the 25% for beneficiaries. But what the big change is going to be in the numbers, because when the beneficiary fills their prescriptions and pays their copays and pays their coinsurance, those numbers all get tallied up, and both the amount the beneficiary pays, so that is the copay or the coinsurance, and how much the insurance company pays and how much the manufacturer pays, all put together, even with their discounts, get added together to get that beneficiary to the next stage. So for example, if a medication is $100 and the copay is $25, then the beneficiary will still pay the $25 copay, and the insurance company will pay the $65, and the drug company will pay the $10 or discount it by $10, making it whole at $100. So in 2024, this would be the same cost for the beneficiary, that 25% or roughly $25 copay in this case, but the amount to get to the next stage and out of that initial coverage copay stage was at a total of $5,030 in 2024, which is simultaneously a lot of medications to get, but also when the medications are really expensive, definitely not enough coverage. Either way, in 2025, that $5,030 number is going to drop way down to $2,000, which would put the beneficiary into the final stage once they reach $2,000 in 2025. This next stage is where all of the magic of the Inflation Reduction Act actually happens, because First of all, in the previous years up to 2025, so 2025 and before, this would have been the donut hole stage, which is when the spend would reach $5,030, and instead of paying co-pays for their medications or co-insurances, beneficiaries' costs would jump pretty dramatically, as they assumed much bigger portion of their prescription drug costs while in the donut hole. Because once in the donut hole, the beneficiary would then be required to pay a much higher portion of their medications, which if they were Tylenol, not a big deal. But some of the more really expensive medications in that tier 4 or tier 5 medication levels, those costs could be hundreds of dollars, and that would last until the total yearly combined spend went from that $5,030 up to $8,000. I mean, just thinking about that, it's just, ooh, it makes you tighten up for sure. But in 2025, all this is gone. The increased share of cost, the donut hole, the $8,000, gone, because there is a limit, a cap on the total amount that a beneficiary can spend in 2025, which is going to be lower at $2,000. And once that amount is hit, then the prescription drug costs will disappear for the rest of the year, only return like the swallows to San Juan Capistrano on January 1st the next year. So the big change is no donut hole and the implementation of a lower true out-of-pocket cost for medications, and I'm excited for that, and really in the most Medicare nerdy way, really. So that is going to do it for the yearly Part D spend journey, and obviously it is much more simplified than before, and obviously it is considerably less expensive, which I think we can all agree is good. But there are two other aspects that are not directly related to the journey that are going to make the lives of Medicare beneficiaries who are taking medications better, specifically in the case if they are taking insulin. This is because despite the huge population of folks who are using the medication, the cost only really has been going up year after year. Now, included in the new changes in the Part D coverage, there's also a limit put on the cost for insulin, meaning that insulin will be capped at $35 max per month. Now, the only kind of hole to this is the fact that the $35 limit is only on the insulin itself. It is not going to affect the cost of things like insulin pumps or strips or other accoutrements that are used for insulin. Still, I think it'll be a huge benefit to those folks who treat their diabetes with insulin and have been suffering the crazy price increases in cost over the last couple of years. Last up today, and this is sort of one that I have mixed feelings about, is one that will maybe help improve affordability and definitely will affect the yearly Part D medication spend for beneficiaries, is the new Medicare Prescription Drug Premium Payment Plan, which will allow folks to sort of buy now and pay later that approach to their medications, meaning that they can get their expensive medications, then divide that cost up over the remaining months of the year. So technically at the largest span, they only have to pay 1/12 of the total cost every single month. So it's not actually going to save anybody money. It'll just spread that money out over the year. Sort of like, if you spread your peas around on your plate, you can mix them in with your mashed potatoes. You don't get them all at once. Just me? Nobody? But I guess coupled with the new $2,000 limit, it really ends up meaning that the max a person could spend on the month if they have a yearly medications that are very expensive and hit that max, it's gonna be $166 a month for the 12 months. So yeah, it is good and it will be helpful for those folks who would have otherwise had huge spends at the beginning of the year. And it could make it easier to help pay for those costs with their fixed incomes as they are, again, spread out over the entirety of the year. So there you have it. Those are the 5 big changes to the 2025 yearly Medicare Part D prescription drug stages. First is the deductible is up to $590, so a bit of a big increase. Second is the amount limits on the initial spend stage being much lower. Third is the fact that there is now a limit to prescription drug spending at $2,000 a year total for the year. Fourth is the $35 max cost for insulin. And last is the new Medicare prescription payment plan that will allow folks to spread their prescription drug costs out over the entirety of the year to bring down those monthly payments. So that's it for today's Michael's Medicare, and I really hope that you enjoy this video. And if you or somebody you know is trying to work through some of those tough Medicare quandaries, please feel free to reach out to us at the information down below, or leave a comment, or just like and subscribe so you can get notified when our newest Medicare content comes out on the socials, on Instagram and on YouTube, because we have new Medicare content coming out every single week. So for Michael's Medicare, of course, I am Michael, hoping that you have a great rest of your day, and goodbye.